my first photo, I have a chiropractor who treats patients with poor body alignment due to car accidents, sports injuries, and any other situations that cause a strain on the body. His job as a chiropractor is to direct patient care, administer patient care, and to stay within his scope of practice. In this photo, Dr. Green is seen taking care of a patient with acute lower back pain due to a gym injury. But before he can make these adjustments, he had an assistant come in with electrostands to relax the muscles for a few minutes. Afterwards, the stents were taken off, and Dr. Green came in to ask questions about the pain level, where the pain was, and how it occurred. After this, he can make a diagnosis and prognosis to inform him on what manipulations he needed to do. Here you can see Dr. Green applying pressure on the area of pain and slowly moving upwards. After this manipulation, he then gave advice on how to reduce the pain through stretching exercises, and then also gave her a later date to come back. For the next photo, I have Dr. Russo, who is a nephrologist and specializes in kidney care. His first priority as a nephrologist is to educate patients on how to take care of their kidneys through diet. However, if a patient had any issues with their kidneys and needed a kidney transplant, they are directed to a dialysis center. Here, Dr. Russo checks in on the patients and makes any adjustments to a dialyser. A dialyser, which can be seen here, acts as the kidney by taking in the patient's blood, filtering out any harmful chemicals, and bringing it back to the patient. Also can be seen here is Dr. Russo talking to one of the patients by asking him questions on his daily living. Not only does this gain the patient's trust, but also gives him any information that may help him with any adjustments that's needed to the dialyser. Since this situation can take a really long time, they are given a lounge chair and access to television that is around the center. For my last photo, I have a podiatrist who is Dr. Palladino, who specializes in foot and ankle care. Here in his field of work, he deals with heel pain, sprains, fungus nails, and any other foot ailments and injuries. However, his most difficult patients are diabetic patients due to the numbness in their feet. Here, Dr. Palladino occurred with a diabetic patient who had a cut on his toenail and developed an infection. However, the infection was caught early on, and Dr. Palladino was able to cut off the infected area and file it down. Afterwards, he then gave the patient antibiotics and a later date to come back in. Not only that, he also advised the patient, since he is diabetic, to check his feet regularly and nightly.